With members of the National Assembly bracing themselves for a lean chamber on return from recess on Tuesday next week due to the coronavirus, the House leadership has allayed fears of Covid-19 infections in the wake of newspaper reports that 17 MPs have contracted the deadly virus. A statement backed by pathologists Lancet Kenya, commissioned by Parliament to conduct the tests, terming reports of infections as incorrect and misleading, adding that they should be disregarded.
What is not in order is to throw names of even members who I have spoke to who have not even been tested, names of members who their results is to the contrary, names of members who are not even in Nairobi the last 2 weeks. So that is very reckless, it's very irresponsible.
Minority Leader John Mbadi, who was listed among those said to have contracted the virus, says he tested negative. On a day, the number of MPs seeking testing for the virus is said to have risen to 100.
I know the 17 members of parliament is outrageous. You can't have a test of about 50 MPs or 100 MPs. You have 17 of them positive. That would have been captured and flagged off by the ministry very quickly, and the government and the executive. And they would even say that we have tested MPs and a number of them are positive. So there was irresponsibility on the part of the reporters, on the part of the media house. I think they owe Kenyans an apology. Not just MPs, but Kenyans an apology.
In the wake of the scare, a number of MPs, among them Caleb Amisi, went public on their status, even showing proof of lab results which came negative, while dismissing the list as not factual. Gatunde South MP Moses Kuria also appealed to Health Cabinet Secretary Mutahi Kagwe to make public an alleged report on infected MPs, if indeed true.
I was tested on Saturday. The results came out yesterday. If I was positive, you would have not found me here. I would be in hospital. I would be receiving care as at now. If I was positive, I would just come out publicly and say, because I don't see why Kenyans should stigmatize and look at this disease as if you get it is a death sentence, and as if those who get it have committed a crime.
The Ministry of Health is expected to roll out testing of all MPs, an exercise that will be extended to the judiciary to ascertain the state of infections in the two key arms of the government.
The ministry is aware, and we did see the headlines reporting that there are cases, positive cases of coronavirus in Parliament. And what we have to say on this matter is that as it stands today and at this time, we have no formal official reporting of these cases to the Ministry of Health.
National Assembly Speaker Justin Muturi has developed tough guidelines on sitting arrangements in the National Assembly, which requires only a maximum of 70 MPs in the chamber.
We will not have the 349 members. We'll only have, as there's a guideline the Speaker has sent, I'm sure the media has, there will be 60 members who will be in the House, between 60 and 70. And we want to protect the elderly members. We want to protect members who have medical conditions. We want to protect all our members. So at any given time, the quorum for the House is 50.
On resumption to House business, MPs are expected to debate and pass President Uhuru Kenyatta's measures on COVID virus, as well as approve the supplementary budget. Apul Kamau, K24 Evening Edition.